I know that you have a tremendous interest in the issue of fatty liver. You come to the table with some information that makes me some good concern about what the liver is like.
Well, Mike, 2 years ago, we had ultrasound done on patients who had hepatic steatosis or fat in the liver, and we did not worry about it as much. And I started saying, let me just start reading about this. And come to find out, the range between 30 to 45% of Americans have fatty liver. Almost 30% of the world have fatty liver. And it's come from these processed food and too much sugar, frankly, too much sugar. And so because of that, what is fatty liver doing to it? Fatty liver may be causing you to have cholesterol problems, diabetes, being overweight, having hypertension, hypothyroidism, all caused by fatty liver. Additionally, cancer of the pancreas, cancer of the stomach, cancer of the colon, renal failure, fatty liver. So it's a silent disease. It doesn't give you any warning. You may have malaise, you may have some weakness, you may have some pain, you may have nothing. Generally, most people have nothing. So it's a silent disease. And I said, oh my God, our people are going to be left behind on this. How do we get out there and tell people you need to know your numbers about your liver? And since it's not going to talk to you, the only way you can know your numbers, have an ultrasound. If you have an ultrasound, have fat in your liver, you ought to be concerned.